Hey everyone, it's great to see you again. Today we're talking about something that affects millions of Americans, and honestly, it's one of the most important updates you'll hear this year. The government just released a new update on Medicare open enrollment, and while it might sound like just another yearly routine, this year is completely different. Here's why. Starting next year, Medicare plans will include a $2,000 annual cap on out-of-pocket prescription drug costs. That's a huge change, one of the biggest updates to Medicare in years, and it could save countless people thousands of dollars. So, yeah, this isn't something to scroll past. What you learn here could make a real difference for your wallet and your healthcare. Before we dive in, I want to hear from you. What worries you most about Medicare or healthcare coverage? Is it the cost, understanding your options, or just keeping up with all the changes? Let me know in the comments below. I read every one of them. What's happening right now? Medicare open enrollment. Medicare open enrollment is officially underway and runs through December 7th. This is your once-a-year opportunity to review your plan, make changes, or switch to a different type of coverage. Even if you think your current plan is fine, here's the truth. Things change every single year. Doctors can leave your network, co-pays can rise, and benefits that were once included might quietly disappear. And a lot of people don't even notice until January, when it's too late to do anything about it. According to Dr. Mehmet Oz, who now serves as administrator of the Centers for Medicare and Medicaid Services, he put it perfectly. Sometimes these policies change without you knowing it, and you'll have a worse experience next year if you don't check. And he's right, insurance companies make adjustments every year, raising or lowering premiums, changing provider networks, or tweaking drug coverage, so even if you're happy with your plan right now, taking a fresh look could save you hundreds or even thousands next year. What's changing in costs? Premiums, drugs, and Advantage plans. Now let's talk numbers. The average Medicare Part B premium, which covers things like doctor visits and outpatient services, is expected to increase next year. It's currently around $185 per month, but projections suggest it could rise by about $20. Now that might not sound like much, but for someone on a fixed income, that's real money every single month. There is some good news though. Some Part D prescription drug plans may actually see slight decreases in premiums, and Medicare Advantage plans, which bundle hospital, doctor, and drug coverage through private insurers, are expected to stay stable, or even drop in cost for some enrollees. But remember, cheaper isn't always better. It's about value, not just the price tag. If your plan costs less but your doctor isn't covered, or your prescriptions suddenly double in price, that cheaper plan could cost you more in the long run. I've heard from so many viewers who said they woke up in January to find their doctor was out of network or their copay for a heart medication doubled.
And when you're retired, those surprises can throw off your entire budget.
What you should do. Right now. The first thing to do is grab that letter your current plan sent you. It's called the Annual Notice of Change. Every plan must send this before open enrollment. That letter spells out exactly what's changing for next year.
If you didn't get one, call your plan and ask for a copy.
Then review it closely. Check your premiums, co-pays, deductibles, and drug coverage. If anything seems off or confusing, that's your signal to start comparing plans. The good news? Medicare makes that easier than you might think. Head to Medicare.gov. Plug in your prescriptions and even your preferred pharmacy, and you can compare plans side by side, complete with cost estimates for next year. Just a quick tip, those doctor network listings on the site aren't always 100% accurate, so before you finalize your choice, call your doctor's office directly to confirm they're covered. Still, that online tool is one of the best ways to avoid those January surprises. Major drug pricing reform. A new model for fairness. Now let's talk about another big change. And it's a major one. The administration recently introduced the Most Favored Nation model, a policy that forces drug companies to charge Americans similar prices to what they charge in countries like Canada or Germany. For years, Americans have paid 2 or 3 times more for the exact same medications, even when they're made in the same factory overseas. Dr. Oz put it plainly, when you buy a drug in America, it's often 3 times higher than in Europe, even though it's made in the same factory. This reform is designed to level the playing field, cutting down those out-of-pocket costs for people on Medicare, especially for chronic conditions that require expensive ongoing treatments. Now, will it drop prices overnight? Maybe not, but it's an important step toward fairness and affordability, something seniors have been waiting for decades. What about the government shutdown? A lot of people are asking how the government shutdown affects Medicare. Here's what we know. The shutdown has now entered its third week, and it's creating confusion during an already stressful time. President Donald Trump has warned that if the funding dispute continues much longer, it could put pressure on programs like Social Security, Medicare, and Medicaid. He's accused Democrats of blocking funding to push through healthcare benefits for undocumented immigrants, while Democrats argue the shutdown is the result of political brinkmanship. Whatever the politics, here's the key takeaway. Your Medicare coverage and open enrollment are not affected right now. The system is fully operational, and you can still make plan changes through December 7th. That said, it's a reminder of just how politically charged these programs have become. Medicare isn't just a healthcare issue anymore. It's become a central topic in national politics.
A quick note from our partner. We've partnered with Chapter, a service we truly trust for honest, no-pressure Medicare help. They'll connect you with a licensed advisor, compare every available plan in your area, and help you find real savings, often averaging around $100 per year. It's completely free, and their care advocate team will even help you after you've enrolled.
You can call 615-639-1937 or visit askchapter.org money. The link's in the comments below. What you can control. You can't control Washington politics, but you can control your engagement. Make sure you're not overpaying or missing coverage just because you didn't review your plan. This year, some Medicare Advantage plans are also expanding their supplemental benefits to things like help with groceries, transportation to doctor visits, utility support, and gym memberships. Those are real, tangible perks that can improve your quality of life, but not every plan offers them. So check carefully to make sure it applies to you. Feeling overwhelmed? You're not alone. Every year, I get messages from people saying, I just don't know where to start. And I get it. Medicare can be confusing. Between all the letters, parts, premiums, and plan types, it's easy to feel lost. But here's the truth. You don't need to know everything. You just need to take one simple step. Look at what you have. Make sure it still fits your needs. And if it doesn't, make the switch. If you're new to Medicare this year, you may even have extra time to make adjustments. Just don't wait. Even though the tools are better now, there's still a learning curve. And if you're not comfortable using the website, you can always call 1-800-MEDICARE. Real people are available to walk you through your options. A quick public health note. Dr. Oz also mentioned some new research on acetaminophen use during pregnancy and possible links to autism. Now, this isn't a proven causal link, but there's enough growing evidence to suggest caution. His advice was simple. If you don't need it, don't take it. Unless your doctor recommends it. The big takeaway. If you take one thing away from today's video, let it be this. Engagement matters. Medicare is not set it and forget it. The system gives you the tools, but you have to use them. December 7th is your deadline. After that, you're locked into your plan for the next year. So, take a few minutes this week, review your paperwork, hop online, or make a quick call to ensure you're getting the best plan for the money you're paying. And if you've ever had a bad experience, maybe your doctor dropped out of your network, or your prescription suddenly shot up in cost, share your story in the comments. You never know who it might help. Thanks so much for watching, take care, and I'll see you in the next one.